Good morning, and thank you for joining us for the City of Lubbock COVID-19 News Conference. This is our last news conference of 2020. Our next scheduled one will be January 6th in the new year, but today's panelists are Director of Public Health, Catherine Wells, Dr. Ron Cook, Public Health Authority, Mayor Pro Tem Steve Massengale, and our special guests today are Monsignor David Cruz from St. John the Baptist Catholic Church, Pastor Lyndall Lloyd from Lake Ridge United Methodist Church, and Bishop Bill Watson from Alexander Chapel. Let's start with Catherine Wells.
Morning, everyone. As we move into this week of Christmas, we are locally seeing some really positive signs of the pandemic. It's not over, but we definitely have hope. The number of active cases in our community has decreased. We now only have 3,604 active cases, and this is significantly lower than we've had in past weeks. And also, we're not seeing a rapid rise in the number of new cases each day. We're definitely seeing that subside. The good news is that, but still there are individuals who are struggling. Many of us have lost loved ones, and there are still many people in the hospital, including some good friends of mine. For the holidays, remember that we must continue our public health practices. We all have the responsibility to slow the spread, continue to follow social distancing, wear face masks, and stay at home as much as possible. The other good news we're seeing is the vaccine. Lubbock received our first shipments last week, and with the approval of a second vaccine, we're going to see more and more doses arriving here locally. The health department was notified this morning that we will be getting 1,000 doses. These doses will go to essential workers as outlined in the state vaccination plan and include some of our first responders, home health agencies, laboratory personnel, and providers outside the hospital system. Our goal is to get these vaccines to individuals as soon as we get them here at the health department, and we will be releasing those plans over the next couple of days. I will go ahead and pass everything over to Dr. Cook. Thank you.
Thank you, Catherine. It's great that our community is getting all these doses of vaccine. In fact, our community is supposed to get about 9,500 doses of the vaccine into our community, hopefully this next week or this week and next week. And so we're really excited about that. And just as Catherine said, though, even though our numbers are sneaking down just a little bit, we cannot stop doing what we're doing. We must continue to wear our mask. We must continue to physically distance, but still be social, washing our hands and staying in small groups. And I'll talk more about that in a moment. You know, initially our goal with our physical barriers, the masking and social distancing, was to slow down the virus, to flatten that curve. Now that the vaccine is here, we have a cure. It's going to eradicate and eliminate this disease. Fortunately, as a frontline worker, I received my vaccine last Friday. I didn't even feel the injection. I had just a mild bit of tenderness in my deltoid muscle on my shoulder. That was gone within 36 hours. I didn't have any other, what we call systemic. I didn't have any fever or chills or muscle aches or anything. Now, some people have. That's a very common reaction. And we had to give a few people a little bit of Benadryl and some Pepcid for some mild allergic reactions, but no severe. And those were only rare instances of all the doses that were given last week. So don't be afraid of this vaccine. It's a very good vaccine. It's 95% effective, which is fantastic, and it's very safe. And remember, we've got to get our herd immunity to about 80% of the people must be immune to the disease by vaccination before we can return to normal. And the whole goal of the vaccine is so that we can get back to normal, so that we don't have to wear masks, so that we can open up our restaurants and our businesses and get back to normal. So we've got to do that to vaccinate. Remember that if you are positive, we do have the 2 sites where you can get the antibody infusion, and that's bamlanivimab and Regeneron, an antibody cocktail. So if you've recently turned positive and you're high risk, and those high risk indications are age greater than 65, that's can be moved a little bit downward if need to, that you're immunocompromised, that you're either recovering from cancer or a cancer survivor, and or you take a drug that suppresses your immune system, or that you have uncontrolled diabetes, obesity, hypertension, heart disease. Those all would qualify you to receive this antibody drug if you are positive. And we got to give it to you as quickly after you turn positive as possible, within 5 days. Now, remember how I talked to you about Thanksgiving we needed to stay in small groups, and I described what my family did. We set the food out in the garage, and that we had family units that were socially distanced, but we could still socialize and eat together. We all went up to the serving table one by one, that sort of thing. So we don't live in the same household, but we're still physically distant so that we wouldn't infect each other. And so I strongly recommend that you do the same thing at Christmas, that you keep socially distanced and that you stay away from people and keep your groups small. We're not out of the woods yet. We have good news, but we still must maintain the effort to continue to keep this virus at bay until we get more people vaccinated. So lastly, get vaccinated when it's your turn. We have good news that we have lots of vaccine coming to the community, and I have no reason to doubt that it won't continue to come into our community. We have about 12 or 15 community partners that will receive this 9,500 doses. This is fantastic news. Lastly, I want to say, may you be blessed during this holiday season. May you feel the Lord's presence and blessings to you and your family in this coming year. Thank you. Let me hand this off to Mayor Pro Tem Steve Massengill.
Thank you, Dr. Cook. Good morning, everybody. Let me also say Merry Christmas. It's amazing to me that we're at Christmas of 2020, but we are. Let me start first on behalf of the mayor and the city council, just extending our sympathies to those who have lost. Also, sending our sympathies and condolences out to those who have been affected, who might still be sick, for those that have had their livelihoods or businesses affected by the pandemic. We know there's a lot of struggle out there, and we recognize that. So I'm going to start as we normally do by sharing the data slides. Bear with me as I get this up here. Okay. So our first slide today is, as usual, is our hospitalized patients. All these slides I'm going to share with you today trend positively. I would call your attention on this slide to the fact that the last 7 days we've gotten underneath 250 patients with COVID per day. This slide illustrates that we are still in a situation of community spread. There were days that we pointed to that 18 to 25 age group, but we can't do that today. I find it interesting that 30 to 39 has the largest number of cases over the last 14 days. This is a refreshing slide. As you know, when the yellow bars are underneath the line, that means we're short hospital beds. This trend has been positive over the last 7 or 8 days, and we hope to continue that so that we always have beds for those that are sick. So this shows our hospitalization rate as it relates to our trauma service area, also as it relates to the current governor's order. We are trending downward, getting closer to that 20% range. The orange bar is the 15%. We've got to be under 15% for 7 days to be able to roll back to where we were open before we got above 15%. So I'll come back on here. Okay, I think I'm back live there. So it is great to show you the data and show you the data that is trending positively. But I think it's important to note that we must maintain our safety protocols, just as Catherine and Dr. Cook had mentioned before. There's a tremendous amount of virus still out there, and let me illustrate with a personal story. The weekend before Thanksgiving, I tested positive for COVID-19. I was not symptomatic, and I went 3 or 4 days without any symptoms. Tuesday of the Thanksgiving week, I came down with fever. And from that point and through 10 days, I had fever for 10 days. It started with intense headaches that I had never experienced before, and fatigue that I had never experienced before. I honestly have never slept so much. Towards the end of my experience, I could feel the virus in my lungs. Many of you know I'm a runner, and I am very committed to that, but that didn't seem to help me with the virus. It mysteriously attacks, and so I had a bad experience with it. And I tell you that to say that I don't know where I contracted it, but I can tell you don't want it. And I share that story with you to emphasize that we have to continue to wash our hands, wear our masks, and keep ourselves socially distanced so that we can support the rollout of the vaccines so that we can finally eradicate this virus. Before we move into our special guest, I just want to reiterate what Lacey said earlier, that we will not have a press conference next week, and our next press event will be January 6th. So today's kind of a special press conference. If we could have our special guests go and bring their screens up, I'd like to introduce them. We've invited faith leaders today to share some things with us. We're waiting for 2 more. Lacey, you may need to turn their video on. Okay. Welcome, gentlemen. Thank you for joining us. Let me introduce our guest today. We have Monsignor David Cruz. Monsignor Cruz is a Lubbock native and has been a priest for 34 years. He is the pastor of St. John the Baptist Church and currently serves as the Vicar General of the Diocese of Lubbock. Thank you for joining us today, Monsignor. Our next guest is Bishop Bill Watson. Bishop Watson has been in the ministry for 24 years and has served as a pastor for the past 17. He is the pastor of Alexander Chapel and he's also the prelate of Texas Northwest Jurisdiction Church of God in Christ. Thank you, Bishop Watson, for joining us today. And lastly, Lyndall Lloyd. Lyndall is the pastor of Lake Ridge United Methodist Church. He's been a pastor for the past 28 years, and he's led Lake Ridge United Methodist Church for the last 4.5. Lyndall, thank you for joining us today. All right, gentlemen, I'm gonna do this kind of in a moderation form. I'm gonna present you with a question and let you respond. This first question will start with Bishop Watson. We'll go to Monsignor Cruz and finish with Mr. Lloyd. Share a story, maybe something you've learned, maybe a unique experience you had with your congregation during the pandemic. Bishop, we'll start with you.
Certainly. Steve, first of all, just thank you for allowing us the space to share. This year has, by all accounts, has been a trying year. And one of the things that I've come to learn over the many months of this pandemic is that through difficulties, through the heartaches, and through the issues that we've all faced, by all accounts, we are a very resilient people. My family was hit by COVID. My mother and my sister's family and my family as well, all experienced the COVID virus, and some with varying degrees of difficulty kind of rebounding. However, through it all, and when I even look at and not only that, let me say this, not only that, but the denomination that I'm a part of was hit specifically hard. Many bishops, many pastors, elders were, and just lay people, lost lives and were severely affected. But we are, overall, I believe that we are a resilient people. I believe that we've made mistakes along the way, and then we've had some victories. But when we place ourselves in the position to ever be a student of life, we will continue to learn and grow as a church, as a community, as the United States. And when we do that, I believe that the sky is the limit. And I believe that at the end of this thing, we'll look back with many lessons learned, noting that there's some things that we certainly could have done better, but through God's grace and through His mercy, we've rebounded all the way. I believe that.
Thank you, Bishop. Monsignor Cruz. Oh, he's muted. There you go.
Thank you. It's an honor to be with you and to be able to be here with people like yourselves, so dedicated to the common good. In answer to Mr. Massengale's question, I can't help but think of my own brother who I lost to the virus, younger brother, 57 years old. He passed away on October 28th, and his illness was maybe a little bit more than 2.5 weeks. He was hospitalized at the time, and I know that everything was done to try to help him through the illness, but sadly we lost him. He was a veteran for a good number of years. He served in the armed forces, and then most recently he was a case manager for Child Protective Services. And I'm really proud to say that about him, because he loved to serve people who were underserved. And so my heart has been heavy, not just because of the loss of my brother, but other losses that I've seen our community endure. Now, at the same time, my heart has been inspired by so many people. We're still able to worship at John the Baptist. We have 2 services on Saturday and 2 on Sunday morning, in order to do the proper spacing and be sure that we take care of each other as much as possible. But I have to tell you, the courage and the resilience of so many people who continue to help us worship and who continue to fulfill their responsibilities to the community and to God, it gives me great hope, and it inspires me, just like Dr. Cook and Catherine Wells do. So I believe God is using them and other healers and caregivers to help make us all well and to keep us all as healthy as possible. So I thank God for them.
Thank you, Monsignor. We're sorry for your loss as well. Thank you. Lyndall?
Yes, I empathize with the others who have shared that they've had COVID, because in October I had COVID, and so did my wife, and I would tell you it's no joke. It was tough, and so that made it very personal for me going through that experience. But in terms of one of the lessons I've learned, or maybe just something I've been reminded of during this period of time, is that the church is not a building. We've had to think of new ways, and we've had to be innovative and practice adaptive leadership. And so in some ways that's been a great opportunity. I wouldn't wish this experience upon any of us, but one of the things we've been trying to do is look for new ways to be able to share our faith and be the church with one another, for one another, and to impact our community. And so it's been exciting to see some of those things come to fruition. and how that has happened over these past several months.
Thanks, Lyndall. So lastly, let's just talk about what message would you share today with the community, with your congregation. It's Christmas week, and it's Christmas week in a pandemic, something we've never experienced. Lyndall, I'll start with you.
Sure. One of the things I've been concerned about during the pandemic is all the people who've ended up isolated or feeling lonely in the midst of this because they're trying to do the right thing, trying to stay home and take care of themselves. But I know for many of my church members, that's meant a lot of loneliness for them. And so as a pastor, as a person of faith in Jesus Christ, I've really been reminded during this Advent and Christmas season of the Old Testament prophecy from Isaiah chapter 7, verse 14, about the virgin will conceive a child and that his name will be called Emmanuel. And the reason that's important is because Emmanuel means God with us. And I just think in the midst of our loneliness, in the midst of our challenges, in the midst of our struggles, right now I'm trying to remind people that God is with us, that we are not alone, and that He wants to. That's why Jesus came. That's why Jesus was born at Christmas, is so that God might come and be with us in the person of Jesus. And so I hope that's a message that encourages people and gives them hope during this Christmas season.
Lyndall, that's great. Thank you so much. Bishop Watson.
Yes, I like Wendell. I am so familiar with so many people that are feeling despair. Now this is the time of season where there's great joy, but there's also a lot of despair during this time because people have lost loved ones and so on and so forth. And then not only to add on to just the Christmas season, we look at the COVID virus that's added additional weight to the persons. And so I guess what I would want everyone to know is to hold on to hope. There's a scripture in Jeremiah 29:11 that says, I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future. And when I kind of delve into that a bit, biblical hope is quite a bit different than the hope in our dictionaries. The dictionary all defines hope as a feeling that is wanted, that you want, something that you want to happen, or a desire accompanied by an expectation. However, we know that the feelings change and desires dissipate, but the hope of the Bible says that God's hope is based on His promises. God's hope is enduring. God's hope it cannot be frustrated. God's hope will never end. And so it's based, that hope that we experience in the Bible is based on the promises of God, which are yea and amen. So I just want to encourage everybody that in this difficult time and difficult season, I want them to hold to hope and place their hope in God, because that's where we will succeed, with our hope in God.
Thank you, Bishop. Monsignor, your message.
When I think of the beauty of the Christmas story, I think of Jesus becoming human, human just like us in all things, but sin. And so that humanity meant that He knew what it felt like to feel sadness and sorrow, and joy. And He had hopes and dreams and aspirations. He knew how to laugh and smile and how to feel and touch. And so that humanity allowed Him to identify very intimately with our own humanity, which says to me that he knows the feelings that we hold, whether those feelings are fear, despair, anxiety and worry that families are feeling these days, all across our country and our world. He knows all those things. And so Christmas is a time that we are assured in a beautiful way that he understands and he's with us. Not just in as a little infant in the stable, in the manger in Bethlehem, but in his spirit that dwells in us, in the hearts of all believers. And we just have to hold on to that belief that he understands and he's with us, and therefore we're not alone.
Monsignor, thank you. Gentlemen, to all of you, thank you very much. Thank you for sharing your stories with the community today and your messages of inspiration. I wish each and every one of you a Merry Christmas and have a great week. We're going to allow y'all to turn your screens off. If you will mute, we're going to move into our Q&A session of our press conference this morning.
Okay, thank you, everyone. Now we'll open it up for media questions, and today's media order is Texas Tech Public Media, El Editor, KMEC, KOBK, Latino Lubbock, KCBD, and the Lubbock Avalanche Journal. So we'll start with Sarah Self-Walbrick with Texas Tech Public Media.
Hello, everyone. Thank you all for being here today. It was good to hear some different voices on here as well. Dr. Cook, I think both of my questions are for you. We're all relieved to see the dip in hospitalizations. That's obviously some good news to hopefully continue to end the year on. What trends are contributing to that? Why are we seeing this dip?
You know, Sarah, I don't have a good answer other than we hopefully are keeping our distance and not spreading the virus and paying attention to quarantine. And as Mayor Pro Tem said, I think we did a pretty good job after Thanksgiving and maybe keeping some of our groups small. And so, but all that to say is we must continue. We don't need to bump our numbers back up. So, I don't have a good source, but that's I think most of us on this panel would probably say that.
Good deal. And then as a follow-up, and we've already talked about this a little bit, but now that we've seen and we've been using these antibody therapies for a few weeks now, have we seen many effects of that on our numbers? What's the response been to folks that have gone through that antibody therapy treatment?
We have given out we have infused about 378 people, if I did my math right this morning, with this antibody, the two antibody drugs. Most of it has been with bamlanivimab and a few Regeneron. And so we think it's made somewhat of a difference. The whole goal there is to keep patients out of the hospital. When you become positive and you're high risk, it's our theory, and the studies have shown that it may help prevent, if you get the infusion, that it'll do a pretty good job of keeping you out of the hospital. Not everybody, but most people, about 60 to 70%, it may very well benefit those individuals that receive the infusion. So, one of the key points there, Sarah, is to get it early on so that we don't get too far behind the 8 ball within those first few days to give it to you, and then we're already that far behind.
Good deal. Thank you all. Happy holidays.
Thanks, Sarah. You too.
Thank you.
Thank you.
Okay, next we have Olga Aguero with El Editor.
Buenos dias. Good to see y'all.
Mm-hmm.
It was good to see Bishop and Monsignor and Pastor there. Sort of give you that feeling, that inspiration that we all need right now, right before the holidays, so we can continue praying for hope, peace, and love. I'm glad that the vaccine is there and it's going to start doing its miracle job. My question is, are we going to get 1,000 at a time, or was this 1,000 the first shipment? And I know it won't cover all the medical and caregivers. how soon after will we start getting more than 1,000 vaccines for Lubbock?
We've seen more than 1,000 here in Lubbock. Actually, our hospitals both received around 1,900 each. This thousand's allocated for the health department. And our goal with that initial doses of vaccine is to kind of fill in the gaps between our frontline workers that aren't associated with the hospitals, to make sure that they get vaccinated. And the state and DSHS has been telling me that we're going to continue to see allocations every week as more and more vaccines available. So this is just the beginning.
Good. How will the rural small towns be getting vaccinated, or whereabout will these people be in the line?
Well, our vaccine right now is only for the frontline workers, and we don't quite have that full distribution. We're seeing vaccines going to pharmacies. We're seeing them go to providers' offices. So when we get to the point of vaccinating the community, we're going to see vaccine at a lot of different places. And people can either come into Lubbock to get that vaccine, or they will see it at their local providers' offices.
Can you sort of estimate a date? I'm sorry, more or less when people could sort of see a date for that?
From what I've seen, and this is just an estimate, we're looking at later in the springtime of being able to start vaccinating individuals outside of nursing homes and our frontline workers. But that can change. There's lots of different timelines going on. My goal with the health department is to try to secure as much vaccine for Lubbock and our surrounding areas so we can get our community vaccines.
Thank you. I would like to say Merry Christmas to y'all, and express this love and faith and hope that we're all reaching and striving for, and enjoy your loved ones and be safe. Thank you.
Thank you.
Merry
Thank you,
Christmas
Olga.
to you too.
Thank you, Olga. Now we move to KMAC with Matt Still.
Thanks so much, Lacey. To Bishop, Monsignor, Reverend Lloyd, thank you so much for being on this, for that perspective we really need as we go into the holidays. Dr. Cook, and this question may be for Catherine Wells. We got a list of those areas of Texas that will be getting the Moderna vaccine today. Lubbock was not on that list. When should we know, or when will we get the Moderna vaccine, or has the state informed you of that?
Yeah, so they informed me this morning that the health department will be receiving the Moderna vaccine. On the list from the state, I know some vaccines going to United Pharmacies. Additional vaccine was going to the Health Science Center and some of our community clinics, in addition to the health department.
Gotcha. Dr. Cook, you mentioned earlier about Christmas. It seems like we did pretty well with Thanksgiving. Is there a specific number? Because we know some folks are going to want to maybe gather in small groups. Is there a number that you should say, hey, if you are going to gather, social distance, but keep it at less than 10, less than 6? Is there a specific number, or what do you have to folks who may do something small on Friday or this weekend?
You know, the current recommendations, Matt, are less than 10, and only those individuals in your immediate family, and preferably under your own roof. And if they're not under your own roof, certainly still keep socially distanced, being outside if possible. The weather's going to be a little bit nippy come Thanksgiving or Christmas Day, but I think we can bundle up and move outside and move into the garage and open one of the garage doors if you have that available to you, and just make sure you maintain distance.
Got it. Happy holidays, everybody. Thank you.
Thanks, Matt. You too.
Thanks, Matt. You're muted, Lacey.
I don't see Terry Furman, so we'll move on to Latino Lubbock with Christy Martinez Garcia.
Good afternoon, everybody, and thank you for sharing, Steve. Thank you for sharing your story with us, and all of you for being here, because I know that it's been a struggle for us all. But My first question has to do with, there's been a disproportionate incidence of COVID-19 infection, hospitalization, and deaths among persons identifying as Hispanic or Latino. I know part of that is because it was a little bit of a delay in testing and whatnot. And then, of course, mistrust. Catherine, of course, this is for you because I know that we're now preparing. Slowly, the vaccines are coming in. Please tell me that you have a really good plan in place so that we can help you to make sure that we tackle this and we can avoid any additional deaths.
Yeah, we are lots of moving parts right now with vaccines, but I do want to make sure that we engage all communities and make sure that the vaccine's accessible to individuals. The vaccine's going to be free, so there's no cost. I want to make sure that we have vaccine available in all areas of the community so people can easily get to the places to get vaccinated.
Awesome.
Hey, let me just add on there, if you don't mind. Alert Communications met last week. We talked specifically about how we'll communicate the need and how you would get the vaccine. We spent a lot of time on how diverse that message needs to be and to make sure that we are really working at the grassroots level to help communicate the confidence that we should have in the vaccine, as well as the call to action to get your vaccine so that we can build herd immunity, and the fact that that vaccine is free.
And that's good to know about that it's free. Dr. Cook, my next question, today there was a report on, a lot of people, I feel like it's important that we emphasize that not only are you going to do one vaccine, but you've got to do the follow-up. But today there was also some concern that some folks are going to get the vaccine from one, like say Moderna, and then do another one from, another company. Can you please emphasize to those watching that they have to stay in the same vaccine bracket?
Bring up a great point, Christy. And you probably heard that I was vaccinated this past Friday. When you go get vaccinated, I don't know if you can see that or not, but it's a card that has information on it of who I received the vaccine from. So mine was from Pfizer. So it actually says Pfizer on it. And so you do bring up a good point. You need to make sure if you got Moderna that you get the second dose from Moderna. If you get the first dose from Pfizer, you need to make sure you get the dose from Pfizer. So, but every individual is given one of those cards when they get their vaccination.
Thank you, Christy. Now we move on to KCBD and Karen McKay.
Good morning, everybody. I guess
morning.
now it's afternoon. We've talked about the vaccines that are coming. Catherine, you said 1,000 to the health department. And Dr. Cook, you said 9,500 into the community. We're reading something that's amusing on Facebook. Somebody even posted they got a job at HEB and they're excited that they got the vaccine through HEB. Is there any chance that some pharmacies are already getting this vaccine? It's already going out to some areas?
There are pharmacies that are going to get it. I don't know exactly when. It may be this week, but it could be our partners at United, and also I think HEB is on the list, and Market Street would be under United, but yes. But those individuals, it's only frontline workers, phase 1 individuals right now that are qualifying for the vaccine. So not everybody yet. Your time will come, but we got to get our frontline individuals vaccinated first.
And Dr. Cook, we always talk about the flu. There are certain people who should not get the vaccine under 6 months of age, and people who have an allergy to eggs or whatever. Can you explain? Is there a group who should be advised not to get this vaccine or talk to their doctor first, say for neurological issues or whatever?
We've not seen any of those neurological issues like we've seen sometimes on rare occasion with flu. You're talking about Guillain-Barré syndrome. This is a totally different vaccine. It's an mRNA vaccine. The flu virus or flu vaccine is not an mRNA vaccine. It's totally different. Right now, there's no absolute contraindications. We have not approved it for children under the age of 16. And pregnancy is, I've noticed a lot of women already that are pregnant getting the vaccine. It's not really a contraindication. What we do recommend is you discuss that with your provider first before getting it.
Thank you, Karen. Now we have Matt Dotre with the Lubbock Avalanche Journal.
Good afternoon, everyone. Dr. Cook, so we haven't really talked about a Christmas spike. Are you anticipating that? And I guess, did we really see a Thanksgiving spike like anticipated?
Matt, I don't think we probably saw a little bit of a bump after Thanksgiving. What we didn't see is a big drop off after Thanksgiving. We were still kind of in our climb, and it didn't flatten as much. I went up a little bit, but what we didn't see was a big decline. So which means, yes, we had some of those positive tests, hospitalizations really related to Thanksgiving. Yes, I expect that we'll have some continuance or not flattening of the curve after Christmas, and it's about 2 to 3 weeks after the event. And so there was a study that just came out, I was reading this morning, that said for every 100 positive tests, there are 1.6 deaths related to those 100 tests with a lag time of about 21 to 22 days. So that brings it home, hopefully. So let's keep our positive test down. And the way we keep our positive test down is to socially distance, wear your facial covering. Let's don't stop yet.
Very good, thank you. And as well as, can you just talk a bit about the logistics involved of organizing all these vaccines? So it seems like you said United's getting some, and then other pharmacies are getting some. I think Dr. Cook, you may have mentioned last week that like 8 pharmacies are expected to get some doses of vaccines. So can you just talk about the logistics involved and how you're kind of organizing all of that? I mean, I'm assuming these pharmacies know that right now it's healthcare workers and I guess those involved with healthcare. But can you just kind of talk about how this is all being organized?
Yeah, so the decisions based on who is actually getting the vaccine shipped to them comes from the Texas Department of State Health Services. So they have a advisory committee that says who we should vaccinate, and that's approved. And then there's another group that actually decides on where the vaccine goes. Locally, our goal is to ensure that those who receive the vaccine get connected with those who need the vaccine based on those tiers. And that's where we're going to be working with those providers. And then as the health department with the vaccine we receive, really fill in those gaps. And then as soon as we can move down to the next tier, really start pushing the vaccine out to make sure that our community members have access.
Thank you, Matt. That concludes our media question and answer portion, and that concludes our news conference, our last one of 2020. Thank you to our panelists, our special guests, and our interpreter. Our next scheduled news conference will be January 6th, 2021. That's Wednesday, and it will be at 11:30 as usual. In the meantime, have a very Merry Christmas and a Happy New Year.
Happy New Year.
Happy New Year. God bless.